A new U.S. government report finds hospitals face a combination of problems: slow testing, equipment shortages, and staff burnout that make it much harder to deal with the coronavirus. And now there's one more problem. Many of these hospitals are suddenly losing revenue. Our consumer investigative correspondent Anna Werner shows us how hospitals are trying to reduce costs by, if you can believe it, temporarily cutting staff.
In Florida, at Miami-Dade County's Jackson Memorial Hospital, executives say they're taking pay cuts, and other employees are being asked to go on temporary furloughs due to the financial strain.
We were required to take time off. We were required to take our personal leave time.
RN case manager Angela Freshly Fairchild was surprised to receive an email saying she would be mandated to take a week off in the middle of the crisis.
I couldn't understand that because all around the country, they're asking for nurses right now. They're asking for healthcare workers to work in facilities that are dire need with the coronavirus and the increased numbers of coronavirus cases.
The ripple effects of preparing for the coronavirus are hitting hospitals around the country. Boston Medical Center Health System temporarily furloughed some 700 employees. A health system in Sarasota, Florida, said its revenue dropped by $16 million in March. It's furloughing some employees, trimming hours for others. Similar cuts are in place at a Syracuse, New York hospital. The problems are reflected in a new nationwide survey of hospitals from the Inspector General for HHS. Ann Maxwell is an assistant IG.
In order to prepare appropriately for taking care of this infectious disease, the hospitals have stopped elective procedures, which bring in money to the hospital. They've stopped other procedures as well. So they're losing revenue.
Back in Miami, the CEO of the Jackson Health System, which runs Jackson Memorial, is Carlos Magoya. He says the answers are in the math.
Again, we're a public health system. Our operating margins are really, really tiny. We don't make a whole lot of money. And we don't have the huge working capital of a lot of for-profit healthcare systems.
He says since his hospitals have stopped doing most elective surgeries, his system has lost 40% of its revenue and predicts it will lose $25 million in the month of April alone. So he says he's keeping frontline doctors and nurses, but cutting wherever else he can.
When do you think some of these hospitals might hit bottom?
We're already hitting bottom. The moment the revenue stopped coming in, the bottom is already there. We just don't know for how long a period of time.
Some hospitals indicate that they can and will call workers back when the need becomes greatest here, but Magoya says it would help them a lot if they knew when the federal stimulus money that hospitals are expecting was going to come in. He says it could take months. In response to this report by the IG, by the way, the Health and Human Services spokesperson said they are working hard to support local communities. Gail.
Boy, Anna, this is a head scratcher because this is such a hands-on-deck situation, and their skills are so needed at this time. Thank you. Thank you very much.